Breaking now, Harris County Judge Lina Hidalgo is taking a leave of absence to receive treatment for depression.
We learned about this about 2 hours ago. Reporter Jason Miles live downtown after speaking with Harris County officials. Hey, Jason.
Hey there. Yeah, I spoke with Precinct 1 Commissioner Rodney Ellis just within the last hour. As the longest serving commissioner currently on Commissioner's Court here in Harris County, he'll be taking over duties when it comes to running the meetings, something that Judge Lina Hidalgo does. In her statement shared on social media just within the last few hours this afternoon, she says she was undiagnosed with clinical depression until recently, adding it's important personally and professionally to confront the issue swiftly. Commissioner Ellis telling me Hidalgo is at an inpatient facility out of state, but he does not want to violate her privacy by saying exactly where she is. Now, Hidalgo writes in her message that her administration has stressed mental health services since she's been in office. Now it's something she needs to address.
I want to commend her for making the decision to get the help that she needs. And I want to commend her for going public with it. A lot of people would not. So 6 years on council.
He and others say her coming out publicly with the diagnosis of clinical depression may help destigmatize it among others who suffer from depression. Now, several commissioners sharing their thoughts on social media this afternoon. Hidalgo will still be available in the event of an emergency, according to her statement. Meanwhile, her chief of staff is handling things day to day in her office. Ellis tells me that he expects her to be out for about 2 weeks, but ultimately that is up to her physician. Reporting live downtown, Jason Miles, KHOU 11 News.
Jason, thank you. We know a lot of people struggle with depression, and for more information, we're joined now by psychiatrist Dr. Lokesh Shahani with UT Health. Thank you so much for being here, Dr. Shahani. We want to be clear, though, first, you are not the judge's doctor, and you do not know about her personal situation or diagnosis. But what does it mean to be clinically depressed, and what are the signs?
So when most people say about clinical depression, I or more psychiatrists will interpret as a major depressive disorder. Major depressive disorder is an episode of depression that has lasted for 2 or more weeks. The classical symptoms and signs of depression would be feeling sad, not enjoying activities that you would previously be enjoying, feeling too tired, either sleeping too much or sleeping too little, eating too much or eating too little, just not able to focus and concentrate on work, and then at times also having wishes that you were not alive or having suicidal thoughts. I think those are the big symptoms of depression.
So Judge Lina Hidalgo has checked herself into an out-of-state facility for the next few weeks. In general, what is the course of treatment for clinical depression, and is there an advantage to seeking treatment at an outside facility?
So every person's case is different. Every person has their right to choose a facility of their interest. I'm the chief medical officer for the UT Health Houston John S. Dunn Behavioral Sciences Center. We treat a lot of patients for depression at our facility. Some of the common things that we do is, we focus on adding a patient on an antidepressant and some other medications to help them with their depression. A lot of the inpatient stay also focuses on psychotherapy or counseling, where we really like to kind of dig deep into what's causing the depression, as well as try to, work with the patient to better understand the problem and help them cope up with the problem. The typical length of stay at our facility or any other psychiatric facility is somewhere between 7 to 10 to 14 days. It's a personal choice on which facility you choose.
Dr. Shahani, if someone is struggling, at what point should they seek professional help?
What I recommend is all patients is seek treatment sooner than later. The sooner you treat the disease, probably is going to be in the milder stage, and you would respond much more favorably and in a much more earlier manner. If your depression is to the point that you're a risk of harm to yourself, which means you're having suicidal thoughts or thoughts of hurting yourself, or you're not able to function in life, which means you're too tired, not eating much, or having some physical problems, those would be signs that someone would need treatment urgently.
All right, Dr. Shahani, thank you so much. And if you or someone you know is struggling with mental health, you can call Harris County's 24/7 crisis line at 713-970-7000. That's 713-970-7000. You can also text the National Crisis Lifeline 988 at any time to speak with someone in English or Spanish.